Welcome guys. So today I'll be talking about assessment of a depressed patient using Phq9 assessment charts. Okay, this is the way it looks and this is the treatment plan. All right, so it's mostly a community setting procedure, but you can still get it in another setting. So make sure you do your checks, your normal startup checks. Like, I approach my scene, I see my scene is safe to approach, nothing to trip me or fall, I'm happy to proceed. I'll draw the curtain to provide privacy and dignity for my patient. I'll do my hand hygiene according to WHO guidelines, put an ample of alcohol gel on my palm, rub my hand palm to palm, right hand over left dozen with fingers interlaced and vice versa. Palm to palm with fingers interlaced, fingers interlocked, rotational rubbing of the thumb, tips of the finger, and the wrist. I allow my hand to dry for 30 seconds and I'm happy to proceed. Hello, my name is Frances. You do your introduction, you introduce yourself to the patient, you tell the patient the reason why you're there, you do your allergic check, you do your normal bands check. Normally in a community setting the patient does not have a wristband. Okay, so you do your check verbally, you also check against your paperwork. All right, so after doing all that, you now go ahead and tell the patient that's just exactly what I said before, the reason you're there. So remember, this patient is depressed. You find a way of speaking to the patient so that the patient will be comfortable. Of course, you know the mental health is not really stable at that point. Okay, something must have happened to that patient, making the patient to be depressed. So you have a question here already in the exam. It is circled out for you already. So make sure you do your scoring very well. Your examiner will be checking your scoring, the total score, and will be seeing how you're going to advise this patient using the treatment plan. So I have here, what you do is you don't have to ask all those questions. Okay, you can just ask 3 questions and that's fine. All right, so I can see here you're asking the patient now, all right, Mrs. Barry or Mr. Barry, I can see here you have a little interest or pleasure in doing things. Can you tell me about it? Why are you having little pleasure in doing things or little interest in doing things? The patient to tell you, oh, that she lost her grandfather and since then he has not been himself, that he's not finding it interesting to join anything at all, any activities. Or you now advise the patient, okay, all right, don't worry, you to be taken care of, I'm here to help you. All right, so make sure you just reassure the patient at that point, because you still have other questions to go. And remember, you have 20 minutes to complete this chart and go back to your assessment. All right, so you go to the next question. All right, I can see here that you're having trouble falling asleep, staying asleep, or sleeping too much. Why is it so? The patient will tell you, yes, because of that. Whenever I remember whenever he remembers his grandfather, he will not be able to sleep. He can't sleep at all. So you advise the patient, all right, no problem. Is it possible for me to get your, but that should come after, but just give the patient a little reassurance. Is it possible for me to get any of your family member to come stay with you, and maybe the person will engage you in chats and other things to do so you can fall asleep and be happy? Patient will say, if that will help, yeah, that's fine, that's good. Then you note that well as well. So the patient will also tell you, you ask the patient, sorry, why do you have trouble concentrating on things such as reading the newspaper or watching television? Patient tell you, of course, I don't have any interest in doing any of those things. Why will I be happy and all that? Patient might be giving you reasons why he cannot concentrate in doing these things. So you now advise the patient, okay, so don't worry. Are you happy for me to refer you to the psychotherapist? The patient will tell you, yes, of course, the patient wants to get better. You tell you yes, all right, no problem. So don't worry, I'm going to calculate my scores and I'll come back and give you advice based on what my calculation is. Is that okay? The patient to say yes. Then you go back. Now you can see here, the first column is usually 0. The second column is 1, 1. So your total score here, your score here is 2. Then the third column is 2, 2, 2, which is 6. The fourth one is 3, 3, 3, which is 9. So when you calculate everything, 1 plus 6 is 2 plus 6 is 8. 8 plus 9 is 17. So your total score at the last column here is 17. So you go back now, based on what you've gotten, which is 17, you go back here, you check the scoring system. So 17 here falls in between 15 to 19, which is a provisional diagnosis. Don't tell the patient you're having major depression. No, don't do that. So you're likely to have major depression from what I can see here, which is a provisional diagnosis. Is not the actual diagnosis. Okay, so you're having major depression, moderately severe depression. Okay, so but I'm going to be escalating this to your doctor so that it can help you with some antidepressants or psychotherapy. Okay, so I'll be referring, if you're happy for me to refer you to the psychotherapist, then your doctor, then I'll do that. Are you happy for me to do that? The patient will say yes. So of course, the treatment plan or treatment recommendation for this patient is psychotherapy and antidepressants, which will help the patient. So after doing this, you now go back to the patient. All right, Mr. Barry, I can see here, just like I told you, you're having it's likely that you're having major depression. Okay, so I'm going to be referring you now to the doctor. Since you've given me your consent, I'll be referring you to the doctor and the psychotherapist. Okay, so you now, after doing that, now you've reassured the patient, then you now go back quickly to start up your assessment. You assess the patient vital signs, the temperature, pulse, respiration, SpO2, blood pressure. Okay, so after doing that, you also go back again to tell the patient your findings. You see, you don't have time, so you have to be fast. Don't worry, it's not difficult at all. This is one of the simplest even. Okay, so remember, we have Phq9, we have Morse tool, we have GCS, so you never can tell which one you'll be getting. So Phq9 is one of the assessments you are likely to do in your OSCE. So after doing all this, remember to do your hand hygiene when you finish. So at every point, even your assessment, that will be another video for another day. That's assessment, the vital signs check and everything, assessment you need to do for the patient alongside with this Phq9. So but the first thing you need to do, depend on what you want, but mostly you do your Phq9 first before going for your vital signs check. And remember, you need to advise the patient. Remember all those traps they'll set for you, like they might keep a cigarette there. Of course, you know what to do. You have to tackle the cigarette. You ask the patient, make sure you are not telling the patient, why are you smoking? Why? No, don't do that. If you see a cigarette there as a trap, you can say, oh, I can see, Mr. Barry, that there's a cigarette here. Is it for you? Patient will tell you yes. Okay, all right. Are you happy to stop smoking? Patient will tell you, yes, I'm happy to stop smoking. You say, oh, that's fine, okay. Are you happy for me to refer you to the smoking cessation team? The patient will tell you, do you think that will help me? You'd say yes. Then you go ahead and refer the patient. So it depends on what you see as a trap during your assessment. Make sure you tackle those traps. They are very important. Eyeglasses can be a trap. Glass of water, glass of juice, sweets, biscuits, all those things can be a trap. Walking stick can be a trap as well. So that's the end of this video. I'll be making a video on assessment, but not just now. I will be making a video later on assessment. Okay, so this is the chart and this is the treatment plan. So you also have your assessment, that's your vital sign chart as well, that you will need to fill up, remember. All right, so now I'm done. Okay, Mr. Barry, I'll be leaving you now. I'll open the curtain. I'll make sure I take every equipment I've used back to the treatment room or back to where I'm coming. Remember, it's a community setting. I'll take them back. Then I'll leave you now. Okay, make sure you leave professionally. Then I'll put an ample of alcohol gel on my palm, rub my hand palm to palm, right hand over left ozone with fingers interlaced and vice versa. Palm to palm with fingers interlaced, fingers interlock, rotational rubbing of the thumb, tips of the finger, and the wrist. And that's very simple, guys. All right, so in case if you're having other scores here, we have 5 to 9, 10 to 14, then 15 to 19, which is one we just tackled, then greater than 20. Whatever it is here, it is there for you to read out for this patient, guys. It's not difficult. Just read it out, know what the provisional diagnosis is, then you know the treatment recommendation to give the patient. So you are reading it out for the patient, so it's not difficult. All right, guys, thanks for watching. Please like and share my video. Like, comment, ask your questions, share to your friends who are preparing for OSCE. Thank you, guys. Bye.